Welcome to Yoga Talk. My name is Diane Covanda, and with me here today is Patricia Fater, a fabulous family physician, MD, and thank you for coming on today.
Again, a pleasure.
Can you tell us a little bit about the relation between yoga practice and different ailments and issues, health issues that people have, and how it might be helpful for some things?
Certainly. I think, as I've mentioned, movement is a basic part of health and well-being, part of a healthy lifestyle. Good eating, hydration, good sleep, and healthy movement. Yoga, as part of that, is helpful for just basic underlying metabolism and helps, as we know, with cardiovascularly, muscularly, with digestion, and depending on the intensity, can be utilized in all those specific fields. With regards to health concerns as they come up, one of the first things that people ask about use for yoga has to do with things like high blood pressure, heart disease, the quote type A personality, and how can they use yoga to help them. The marriage of movement with mindfulness that is yoga is extremely beneficial to any given individual given their practice. The studies that have been done, and there have been several, have come to expose the fact that yoga practice, when done routinely, can help lower blood pressure. It doesn't lower it like a modern medicine might by 10 or 15 points of the systolic or diastolic blood pressure, but it can lower it 3 to 4 reliably, which means in a meta-analysis which was done taking several studies, there were people who significantly lowered their blood pressure with the only difference from control being yoga. My own experience with this with my patients and my own personal viewpoint of it is possibly it has more to do than just with yoga. When someone begins adopting yoga as part of a lifestyle change, or a TLC, therapeutic lifestyle change, it seems to expand into other parts of their life. So it may be that as the mindfulness that they bring to their yoga practice expands into more mindful eating, which might be a healthier habits eating than they had before. It may be a reduction in caffeine. It may be a reduction in processed foods, which have a lot of sodium in them, and as well as other things. And it may be that as their mindfulness practice and their physicality increases, that their sleep is better. Sleep is also fundamental to good health. And the studies that have been done don't break it down like that, but it seems to me, intuitively or through my experience with patients, that patients who begin to adopt a kind of yoga-inspired lifestyle make many changes that could be healthful and helpful in lowering blood pressure.
So as you're saying that if you start practicing yoga, you may find changes that you're innately making in the rest of your life. I would imagine that as you're practicing the mindfulness with every movement, with every breath, that mindfulness goes out to all different parts of your life.
Exactly.
Right? So then you're learning, you're practicing how to maybe be mindful of this movement and feeling your muscles stretch and strengthen and what the sensations feel like. Then later on, you might be mindful of how much you're eating or the flavor of the food and
or the choices,
the
choices
right?
Making, yeah. And I'm not saying that everybody that goes to a yoga class has to completely alter their lifestyle, but it seems something that comes naturally as we study mindfulness more. We find that there are physical changes in the brain, and the science of neuroplasticity is evolving. The changes that are occurring might make us make different decisions in other parts of our life. That might be helpful.
That's great. I was wondering if there's other things that you've come across, maybe back pain issues or things like that, that people have applied yoga to?
Low back pain is, as we all know, an extremely common experience in the human body. It's not necessarily designed to be upright, and certainly not necessarily designed to withstand the strains that modern life puts on our low back. Other meta-analyses have been done, which means that they take a bunch of different studies that were done. Each study wasn't particularly powerful, but when you try and combine the data together in what's called a meta-analysis, you're able to make a stronger declaration about the findings. Recently, because Western medicine is becoming more interested in this, this is being done more. And low back pain is an area in which we can say that yoga practice is very helpful. When I say yoga practice, now as we know, there are 17 different kinds of yoga that you can find, so it's not necessarily every practice is good for every person, but in the generic term, yoga practice has been found to be significantly helpful in low back pain. That's an area of study in many areas: surgery, use of medications, injections, pain management, and yoga is one of those areas that has definitely been found to be helpful for people.
I've had quite a few people over the years come in and say, my doctor said this would be good for my back pain, because we did all the other things that needed to be done and checked it all out, and they said it was either stress in the muscles or whatever might be helped with yoga. And they say, you know, I've been to a power class or something else kind of class that didn't help with the back pain. And I say, start with the restorative, start with the gentle, start at that end of the spectrum. And if you love power, work up to it, but don't just jump into the hardest class, because I think a lot of us are really built for that no pain, no gain, and I've got to be sweating. And it's called yoga, so I've got back pain. I'm going to run in there and do it all really fast and powerfully. And
I'm gonna share
back
with you.
off, right?
I'm going to share with you a piece of wisdom, which 4 years of medical school and a whole lot of debt. Most important thing I learned: don't do anything that hurts. How's that?
That is good medical advice.
It's pretty. It cost me a lot of time to get that one. There's a difference between good hurt and bad hurt.
Right.
When something needs to be stretched out, you know, it feels good as that stretches. It might have an indication of some discomfort to you, but there's a difference between good hurt and bad hurt. If something is hurting you, don't do that, because your body is going to respond in efforts to protect itself in ways that might further be indicating that you're perpetuating your injury there. You don't want to further injure yourself, so you do something that feels like it's helping.
So don't do it if it hurts.
Don't do anything that hurts, and it's a really important philosophy and thesis. It's not the American way, but it's an important thing for us to be able to recognize that if we have somebody working on us and they're doing something that feels like it's hurting, you need to ask them to stop doing that. If it's a good hurt and they're stretching something out that feels like it needs to be done, that's okay. That's okay, but you need to be in charge of your body there and listen to the signals that it's giving you. So yes, you're absolutely correct. You need to go into the generic term of yoga, understanding that there are differences within that may be crucial for your physical being at that moment in time. And as you progress, it'll evolve as well.
That's great.
Important to remember.
Don't do it if it hurts.
Don't do anything that hurts.
Are there any other places that you have found that people have gone to yoga practice that have helped?
I will say that less well studied is depression. Anxiety has been better studied, and to me, depression and anxiety are two sides of the same coin. And I often recommend it for people who are having difficulty with their coping skills, because again, the practice of mindfulness that is inherent in yoga helps change the way your brain works, changes the chemicals that your brain is making, And we're finding now physically changes the size and shape of different parts of your brain, trying to get the fight or flight response, flight, freeze or fright response, to be more on par with real needs as opposed to with what we work up in our heads. One of my favorite Mark Twain quotes is, "I've lived through many trials and tribulations, most of which never happened." That's what we love to do. We love to worry. We love to masticate about past traumas. But the practice of mindfulness brings us into the present moment, which allows us to enjoy that space and time, creating a shift in the chemicals in your brain, which then go down through your entire body. That feels good. We need to acknowledge our own wisdom about how that feels and that it feels good. So I don't need a meta-analysis to tell me that yoga feels good. I know that it feels good.
And inner biofeedback.
It is doing good for you when it's doing that for you. So the treatment of anxiety, again, I couple it with depression. Has been studied, has been proven, but we know this. We know this from experience in our own bodies, how that changes, how we feel from our skin on in.
One of the things about yoga practice is be here now, right here in this moment, and you practice it over and over by bringing your attention to the breath or what you're feeling in your body. And as you're saying, when we are experiencing making a worry in our head, we play that movie, we're going deeper into that worry and having a physical reaction. When you're practicing yoga, you can't go there. You have to keep coming back to your breath. You have to keep coming back to what you're feeling. And it's just like learning how to play a violin or something. You learn over and over as you practice how to bring your mind back from those neighborhoods it visits.
And I would say you can go there and you can come back.
Right.
And you can go there again and you can come back. And you can go there again and you can come back. And it's the practice of doing that that paves that road and makes that more accessible to you.
So you're creating this resilience.
Absolutely, absolutely. And that tool is also yours outside of the yoga studio. So if you feel yourself having a thing working up inside of you, as we all do, you have that ability to bring that to bear and bring a yoga breath in and have it make all those chemicals go through your body, which feels so good.
Right. That's wonderful.
It's a phenomenal experience, and it's so everybody owns it. We all have that.
So anybody can do yoga.
Anybody can
Young,
do yoga.
old.
In a chair, lying down, standing up, hanging off a cliff on your head, doesn't matter.
It's great.
Wherever you find it, wherever it finds you.
Thank you. Thanks for sharing your wisdom today.
You're very welcome.
And I hope you come back.
I will.
Great. This is Patricia Fater, and you can find her in Katuitt, Massachusetts, as a family physician. Thank you.